Welcome to this video on the AI-augmented physiotherapist, from reactive to proactive care. We will explore the next evolutionary step in musculoskeletal care. There is a paradigm shift happening from episodic to continuous care. The focus is moving away from subjective, high-cost episodic care to objective, value-based, continuous care for optimized outcomes and a reduced burden of disability. Understanding the hierarchy of intelligence is key. Artificial intelligence encompasses machine learning for pattern recognition, which in turn includes deep learning and computer vision for movement analysis. Markerless motion capture is democratizing the gait lab. It offers lab-grade analysis via a standard camera, providing real-time scoring of movement quality with high accuracy for rehab exercises. The digital twin allows for simulation before application. By inputting MRI geometry, surgical parameters, and sensor data, we can predict healing trajectories and minimize re-injury risk. We are quantifying the patient with 1,000 data points per second. This includes internal load via heart rate variability, external load through smart insoles, and metabolic analysis from a smart patch. Digital therapeutics, or DTX, are software as a medical device. They can lead to a 20 to 30% reduction in readmissions and a 30 to 40% reduction in in-person visits while maintaining clinical outcomes. Rehabilitation optimizes outcomes before surgery. Through predictive analytics and guided exercise interventions, functional capacity is enhanced during an active optimization window. The black box problem relates to transparency and accountability in AI. A critical liability question arises. If AI misses a diagnosis, who is responsible? The developer, the hospital, or the therapist? Algorithmic bias presents the risk of inequitable outcomes. Data gaps in training sets can result in failures to accurately predict outcomes for underrepresented groups. Data ownership and privacy in the cloud are challenges. We must balance the utility of big data with individual patient privacy while remaining GDPR and HIPAA compliant and ISO 27001 secure. The economic imperative is value-based care. Currently, 50% of musculoskeletal spend is considered waste. We must prioritize outcomes over costs to create true value. Empathy, the human element, cannot be coded. AI handles the quantitative aspects of care, while humans provide the qualitative and empathetic touch. The future is precision orthopedics and systems medicine. It is a continuous loop involving the patient, wearables, the digital twin, AI analytics, and the physiotherapist. We must embrace the augmentation. The future is not AI versus the physiotherapist. It is AI plus the physiotherapist.